So breast augmentation is one of the more common operations sought after in the United States. It's also got one of the highest satisfaction rates in plastic surgery, along with abdominoplasty and breast reduction. Breast augmentation, in general, obviously people tend to think about making the breast larger, but there's also a very important aspect of shape to the breast, where in addition to any size goals people have, often people have specific shape goals that they either want and find desirable, or certain shapes that they want to avoid. There's a number of options now in terms of how we approach breast augmentation. There have been a lot of recent innovations in the breast implant field, as well as with autologous fat transfer and using different types of autologous tissue. Autologous just means your own tissue, whether it's your own fat or your own skin or other tissue from other places. And so depending upon what your goals are and what your starting point is and what your finish line goals are, you might pick one of several different options. Implants still remain the mainstay of the mainstay and cornerstone of a breast augmentation procedure. That being said, these other tissue-based technologies are catching on, and kind of we're learning how to best use these in patients to get the best possible results. Breast augmentation in general is a pretty short operation when we take an implant approach to it. To place implants, that surgery takes about an hour, hour and a half. Recovery also is on the faster side of things. I still recommend people to take a week off just to allow themselves to recover and have adequate time to completely recover and just feel confident going back to work and activities and things like that. That being said, most people start feeling much better around day 2, day 3. And usually by the end of day 7, people are kind of itching to get back to regular life and regular activities. Another common question is people wonder if the implants require any sort of maintenance or upkeep or monitoring or exchange, things like that. At this point in time, the FDA does recommend screening the implants with an MRI. They do recommend doing that 3 years after the operation and then every 2 years thereafter. That recommendation is being reviewed just because on a practical level for most people, the MRI that frequently is realistically quite cost prohibitive for average people. And from a medical standpoint, it's questionable what the benefit is of that. That being said, that is the current recommendation.